Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then alpha glucosidase inhibitors. Right. Alpha glucosidase inhibitors are three drugs. We have acarbose, then we have meglitol, we have voglibose are the alpha glucosidase inhibitors. Now, first mechanism of action of alpha glucosidase inhibitors. So, as the name says, they inhibit the enzyme. They inhibit the enzyme alpha glucosidase. Alpha glucosidase, these are actually inhibit the enzyme either by competitive inhibition, and also it is a competitive and reverse inhibitors of alpha glucosidase enzyme. They will also, because they will, this alpha glucosidase will convert the complex carbohydrates into simple carbohydrates. So by inhibition of enzyme alpha glucosidase, this will result in inhibition of conversion of this will result in inhibition of conversion of complex carbohydrates to simple carbohydrates. Okay, then they will also cause slow down the extent rate and the extent of carbohydrate absorption. They will help to slow down the rate and extent of carbohydrate absorption. So the absorption from the small intestine is reduced in with the help of this acarbose. So because it decreases the absorption from the small intestine, so thus it reduces the blood sugar levels after meal. So it reduces the postprandial blood sugar levels. Then it can be used in combination with other drugs also. The main advantage is it do not affect the insulin levels. Then it does not cause, no weight gain is not caused by this acarbose. There is no risk of hypoglycemia also. It just inhibits the absorption of blood glucose levels. So what are the uses of acarbose? Acarbose can be used in type 1, and also it can be used in type 2 diabetes mellitus. It can cause impaired glucose tolerance can occur with the help of it. I'm sorry, it can also be used in case of impaired glucose tolerance also we can use acarbose. Then side effects of acarbose are it can cause flatulence or diarrhea. It is also contraindicated in inflammatory bowel disease.
thank you and thank you for watching.